Okay. This video is high risk pregnancy. The one before this is vaccines and capitalism. The next video I'm going to do is about people that are uh, injured from pregnancy, whether it's due to medical care or natural occurrences that happen. So I want to do the high risk pregnancy for people that's going through it, and for them to have the support services. And if you have one, trust me, this is no competition. It's a lot of tasks. Come on, let's network together, okay? Um, I want to do it. I have plans for it, but you'll see, like I say, if you do it, come forth with what you do, and we can network together. There's the, I didn't know about the YouTuber that that passed. Are you praying for me? I don't know about. I forgot the YouTuber name that's in Missouri, but I definitely wrote it down. Um, and I just heard of someone recently the other day that died in childbirth, that left a child behind. There's another lady, she suffered complications from a C-section scar that got infected and never got treated. Well, it did never heal properly. Um, and she was an Asian lady. There are, high risk pregnancy. I should definitely. Um, I used to support financially. Now I didn't make much, but whatever I gave, I considered a great amount for the fact that many can give, but many don't. I used to support in reading the information to people, going to their events, informing people of the events. And so this is when I was young, 16, 18, 19, 20 years old. And so I used to definitely, I was a promoter of the March of Dimes because I believe all babies should be born healthy. That's what was on TV. And that's what I was aware of doing it. So fast forward, I did financially, of course, support it and had other happenings. Um, definitely. Um, of my love for the March of Dimes. That was my love. I was a lover of the March of Dimes. I really was. The website looked nice. Um, and so I didn't feel I needed to further research before, especially not having a child, or when before then, to know how active they were. But once I was in need, it was just a bunch of repetition. It was repetition and it was redundant. Um, they give you this information, but they don't have a personal consultant for you. So if people are giving you money, especially if I know I gave you money, I gave it anonymously when people have been at places and they had the logos for them. And I also had a personal card where it automatically came out of my funds, like when I go buy something, a certain amount of my percentages or the fees that I paid on a card automatically went to the March of Dimes. So by the time when especially I do something like that, by the time I come for my service, you need to have something. Things should definitely be better and available for me. There was not the resources available really to make sure that to understand what a perinatologist is, to understand your rights when with pregnancy, especially if you're not from an area, because everywhere does stuff different. Everywhere does the stuff different. And I was told I couldn't get the insurance unless I had a doctor before leaving out there. I'm not from there, and you're not giving me my time, and I don't like getting there, signing up for stuff and having to switch after the fact. Like that totally throws me unbalanced. I like to go in knowing that this person perfectly knows what they do. Why the hell they license you? If you know what I'm saying, and once you have your license, you shouldn't just want to be common as though you're working with animals, or as though you're working with something like a cell phone or something that you know what I'm saying, but you're working with life, and you could just be just a just a non-factor, just a simple. It's a word. Simple could be could be meaningful, but they devalue the word simple. They devalue meaning of simple. And you know, you don't have the, you know what I'm saying? I don't see these doctors, especially for pregnancy, really doing the fairs, except, you know, that's majority ran by the other race. You know, you don't really know who really to go to. So that's the time when you really need the one that had 17 children to tell you, you know, tell you your experience of who you need to go to and who to work with and stuff like that. That'll be a good for, you know, contact for them. Because one thing I did learn is that, I ain't gonna say learn. Um, One thing I did feel. It ain't about learning, because it ain't like I didn't have an idea, I wasn't aware of it. But the pregnancy, you know, that something is better than nothing. That don't play that with pregnancy, okay? Because one little error can mess you up for life, and what, you know, that's ridiculous. If someone has a sepsis infection or congestive heart failure, they should automatically get their disability. Number one, because it's automatically common sense that they're going to suffer with that condition for 12 months or longer. Um, that's a deep discussion there, and it's something that would have to be a more detailed presentation about it. And then you get these, you get the doctors, they're chatty patty. You get the office staff, they fucking chatty patty. You get these judges, they chatty patty. There's a whole bunch of chatty patty ass motherfuckers that just care about themselves, and they only seek justice for themselves and who get there and suck up to them. And they have people that they just had, you know, they have you thinking, okay, that you doing something really wrong when you done did your best to do right, and you trying to have your condition better. You working hard to make your condition better, and they won't help you. They gonna give you the most cheap generic, and if anything, they gonna criticize you as though they, okay, this ain't the reality. This is, and when you have what are you talking about? I had a condition that was treated for over a year and a half that I complained of, but it didn't get treated. They did not get diagnosed or treated until a year and a half later. More than one condition. Then they want to get there and come with this alleged shit. I don't like that alleged shit. Bitch, that's the fucking diagnosis. Alleged what? The diagnosis ain't a fucking allegation. Stupid ass people with too much opportunity. So, I don't even need to say so. Stop being so playful. No, that's not funny. So we definitely gotta work on improving our care, because they give you this classism care and then want to act like, oh, don't believe everything you hear. No, you treat me like that too. Your encounters with your people is the same way. So don't tell me what not to believe, because you want to keep me dense and you're a manipulator. That's all it is. You know, that's some fucked up shit. How you get there and want to say an actual diagnosis is a fucking allegation. The symptoms of it. Congestive heart failure is not a fucking allegation. It is not a matter. It's just common sense a matter that once you have it, it doesn't matter your age. Children are born not perfectly, so being age has nothing to do with it. You know, but people too young when they born to be ill. So eventually, people that get older, even though they young, they gonna get ill too. They tend to do stuff to get there and make you cuss them out, yeah. They really do. Yeah, my mama sure do got a fever, alright. Yeah, I got a fever because they didn't steam me up. Yeah, they didn't steam me up because they don't do right. They don't do right at all. And definitely reply back to the video. So what I'm gonna name this video is high risk pregnancy and disability. I'm gonna keep it simple like that. Okay, now why are you gonna spit on my arm? That's not cool. High risk pregnancy and disability. So reply back. And I want to do a hangout. So what do you think about a hangout? Oh, now that's, yep, that's very nice. No, do not get on here. I don't like no crumbs. No, go sit at the table. Stuff called bugs. Now I don't have no bugs up in here. And I sure don't need nothing coming up in here neither. My area don't have no bugs. Get out of here and go sit at the table. Talk to y'all later. Somebody